This is COVID-19 Seattle. I'm Dave Ross.
And I'm Aaron Granillo. We could learn today when and how indoor religious services might resume in our states. Governor Inslee was scheduled to announce these rules last week, but postponed his news conference because he needed more time to finalize the plan. President Trump, meanwhile, has made it clear what he wants.
So I'm correcting this injustice and calling houses of worship essential. I call upon governors to allow our churches and places of worship to open right now.
Over the weekend, we heard from Washington's Catholic and Muslim leaders, and they are rejecting the president's calls to restart in-person religious gatherings. They say while they are, of course, anxious to resume services, they want to wait, make sure it's safe to do so. I've heard one of the requirements that at least the Catholics are considering would be no singing during services.
I heard that too. I don't think it's the church itself was imposing that, but of course one of the most famous cases of a super spreader took place at that choir practice. So that might be one of the consequences. I suppose you could argue that if people are spaced far enough apart, it wouldn't be a problem. But it's clear that when you sing, when you try to project, and I will confess, I'm a loud singer in church, that it goes farther than 6 feet. So, and I don't know if any tests have been done to determine if masks can reduce the spread when you are using your diaphragm to project during church. So I guess we might not be able to sing, which would be too bad. I would miss that.
I also wonder about this, though. Speaking of, if you will, religious logistics, because I grew up going to an Orthodox synagogue, actually, where when you read the Torah scroll, singing is part of it. You don't just read it, you sing it. I mean, it's the same, I'm sure, in church services and also, of course, in Islam. I mean, you sing your services. You don't just read the words.
Right, and it's the same in the Catholic Church too. Although the person who is singing the Psalms, for example, from the podium, that's no problem because he's far away or she's far away. But if when the congregation joins in, typically somebody is singing at you from the back, and you're singing into somebody who's right in front of you. And then, of course, if you turn your head from side to side, there's usually people right next to you. So I'm not sure how that would work. As I say, I think it'd be a shame if they had to ban singing. I don't even know if the choir. I mean, the choir is always standing very close together when they're singing. That might not be possible either. I guess the people will just have to decide if it's safe or not.
Right, and just as a reminder, we did hear from one bishop over the weekend who said he could be expecting an announcement from the governor as early as today, so we could have an indication of what religious services will look like by day's end. We'll wait and see. UW Medicine announced it is temporarily laying off as many as 4,000 more employees. Last week, it furloughed about 1,500 staff members because of the cost of its COVID-19 measures and the loss of elective procedures and routine office visits. This new round of furloughs involves members of unions. They are expected to be off the job for anywhere from 1 week to 2 months. UW Medicine President Dr. Lisa Brandenburg says the furlough should not affect care for coronavirus patients and other vital services.
Based on the financial impact of the COVID-19 crisis, we have had to make some tough decisions.
But Dave, this affects 15% of the workforce. When I hear this, I just think about, potentially 4,000 more workers who will have to now file for unemployment in a system that is already, in a lot of ways, incapable of handling it.
I'm assured that these healthcare workers are only being furloughed so that if there is a second spike, another outbreak, they can be called back in. But it just doesn't seem fair somehow, does it, that they should end up sacrificing because of this? And I guess it's because, for whatever reason, people don't think it's necessary or are worried about going in to get their regular checkups. I know that mine I had one scheduled. It was back in April, and they called to cancel it, and I have not rescheduled. I guess I was waiting for them to call back, like my dentist did. I had a routine dental visit scheduled, and they went ahead and proactively sent me a text saying, "Hey, we're open now. Come back in." And so I did. It was kind of cloak and dagger. You have to say, "I'm in the parking lot now. Are you ready for me?" And then this, "Yes, okay, go ahead. Walk to the door and we'll unlock it for you." So there was all that going on. But I guess not enough people have decided to schedule their routine operations or checkups. So note to self, I'll do that right after I finish the broadcast today.
Please do. By the way, here's Dr. Lisa Brandenburg. Again, she's saying they hope this is only temporary because they just want to get back on strong financial footing.
We know that this impacts people. We're doing everything possible to make that as small as possible and to make sure we get back on strong financial footing.
And she says employees will keep their full benefits during these furloughs. So at least there's some good news there.
That's good. And my suggestion is use a little marketing. Send out an email blast to your patients saying, hey, we're open. Come on over.
Well, it sure didn't seem like anybody was scared of the virus at Lake of the Ozarks in Missouri this past weekend.
No, I'm not worried about catching or anything. I mean, I haven't been going around my grandparents or nothing like that till all this stuff's over and good. I mean, if you're worried about it, stay home. If you don't want to catch it, then stay home.
Photos and videos showed countless younger people packed together, enjoying the sunshine, ignoring social distancing guidelines. The bar called their event the Zero Ducks Given Pool Party. I hadn't seen that yet. Okay. I believe there's, we can move on. Now the St. Louis County Department of Health is urging everyone who is at Lake Ozark to self-quarantine for 2 weeks or until they've been tested and the results come back negative. Well, I guess we know what happens when you give people free reign to go out again. You might tell them that you need to self-isolate to...
Yeah, I'm sure they'll all do that.
Yeah, I don't know what's going to happen now.
I saw those pictures. I wouldn't do that even if there wasn't a pandemic going on. I mean, they were literally packed like they were in a subway car, except they're, standing waist deep in pool water. It just doesn't seem sanitary.
I don't know, Dave. Maybe you're a little far removed from college days, perhaps.
Definitely.
I don't know, but I've been to a few...
No, I was a prude even in college. So.
Okay. All right. By the way, here's what one party goer said. The bar checked guest temperatures. They provided hand sanitizer. But the bar owner himself said they couldn't tell who came together as a group or a family. They had to trust that people would keep 6 feet of space. Well, that clearly didn't happen. I do hope, though, that all these people actually do try to get tested now, because maybe we'll get some results from a case study like this. And hey, I mean, if thousands of people went out to a pool party and only a small fraction come back positive, that means we're all allowed to hang out in the water again.
That's right. Then it wouldn't be a problem. Maybe now I'm not sure, because I only saw the picture that got the most coverage, which was that I think it was in a swimming pool at one of those resorts. Mm-hmm. Lake of the Ozarks is a pretty big place.
Right.
So if there may have been other areas where you had a lot more distance and people didn't get sick. I don't have a lot of hope that there's going to be a lot of self-reporting going on as a result of this party. And it could well be that if you're talking about a group of young people, they may get what they consider to be flu symptoms, but don't require hospitalization, and it may turn out okay. I just don't know that they're going to be meticulous about reporting to the health authorities what happens in the next 2 weeks. We will be back tomorrow and every day after with a 10-minute rundown of the daily local news. You can subscribe to this podcast, and you can also find our news coverage on mynorthwest.com or listen live at 97.3 FM.